Hi, everyone. Good morning. Are you not worried about my height? It's a family problem, and I managed to put more 2 inches to make you all stressed. So I'm happy to be here. I'm Sharon Nakitto. I'm the Executive Director of the Youth and Adolescent Representatives of Health Uganda. Today I'll be sharing insights from our work exploring how legal frameworks, policies, and stigma affect adolescents to access SRHR and HIV services in Uganda, and what a right-based approach can be changed. So, a little overview about our organization. It is a youth-led organization that empowers adolescents and young people, including those living with HIV and young key populations, to access health, rights, and opportunities free from stigma and discrimination. Through advocacy and community engagement, YARHU amplifies young voices and promotes equitable, youth-centered health solutions in Uganda. So the background of the problem in Uganda, particularly adolescents, particularly those living with HIV, and those from key populations such as young sex workers, young LGBTQI youth face significant barriers in accessing comprehensive sexual and reproductive health and rights and HIV services. Just to let you know that in my country, it is like a policy that was passed against the homosexuals. So it's a criminal to be homosexual in my country. So my organization, with the partners, we are trying our best to really keep the young populations and to make sure that they can access health services, which is a bit not easy, but we are trying. So there are challenges which are shaped by critical legal environments, unclear consent laws, and deeply embedded stigma. Despite Uganda's national commitment to adolescent health, the gap between policy and implementation continues to marginalize young people, comprising their rights to health and dignity. So the objectives of this were two. It was to explore how legal frameworks, policy gaps, and stigma hinder adolescent SRHR and HIV access, and also to assess the role of legal literacy and youth advocacy and how they can offer practical pathways towards policy reforms and accountability. The methodology we used community-based participatory research approach, where we trained and engaged adolescent peer researchers to collect data through, we had 30 in-depth interviews, lived experiences, and 5 focus groups discussions. We also did, we made sure that we got participants, which were adolescents living with HIV, young sex workers, LGBTQ plus youth, healthcare providers, and legal experts across 5 districts in Uganda. And the thematic analysis was used to identify key patterns around legal barriers, stigma, and youth empowerment. So these are the key findings. There was legal confusion and denial of services, where many adolescents and service providers lacked clarity on consent laws related to HIV testing, contraception, and treatment. This resulted in inconsistent service delivery, as one adolescent girl shared with us that the nurse told her, "I needed my mother's permission to test, but I am 17 and I am already living out of my mother's house, so I walked away without testing," which is a barrier. So there's also stigma, and stigma as a structural barrier. Adolescents from key populations reported fear of being judged, criminalized, or exposed when seeking services, discriminatory attitudes among healthcare providers. We further discourage access, where a young sex worker explained, "They look at you like you are dirty, like you don't deserve help. Even before you speak, they already say no. So this is like a positive finding where we did the youth-led empowerment as a game changer, where legal literacy and peer-led safe spaces dialogues run by our organization significantly improved adolescents' confidence and awareness of their rights. Youth participation reported increased ability to demand services and challenged discrimination. Providers who participated in the training session also showed improved sensitivity and knowledge. This intervention fostered more supportive, adolescent-friendly environments. In conclusion, and these are conclusions and as recommendations, so we need to ensure meaningful access to SRHR and HIV services for adolescents in Uganda, which requires more than policy. It demands practical, right-based implementation. Consent laws must be clarified and widely disseminated, while stigma must be actively dismantled through community engagement and provide sensitization. Most importantly, adolescents must be at the center of change, not just as service recipient, but as informed right holders and policy influencers. This study affirms that youth-led organizations are essential in bridging policy gaps, transforming health services and systems, and ensuring that the voice of the most affected young people are they lead the response. In acknowledgement, I want to thank White Plus Global, the Love Alliance, YARHU, and the Young Emerging Leaders. I know we are so many here, and the global network of people living with HIV for helping us come up with all these findings and putting together this report. Thank you.